being here. Let me start from beginning. So let's start with ISBA. As we all know that OET writing doesn't have any special format. However, our father has used ISBA mother in order to make our writing easy. So ISBA is a tool for organization and planning. It is an internationally accepted tool for communication among the medical professionals. Standardized approach by the hospitals, and it can be used for any type of referral letters, discharge letter, or whatever the type of letter is, we can use ISBA as a for writing. And ISBA can be used among the letters among the nurses to nurses, nurses to doctor, doctors to doctors, or nurses to allied healthcare professional, whomever it is, we can use ISBA in order to make our score better. And again, ISBA, we have 6 content into that is there in our writing, that is purpose, content, concise and clarity, organization, genre and style, and language. Know all this, we need to know all these points in order to get better score. Like for example, for the purpose, the mark is scored between 1 to 3. We need to have at least 2 in order to get our B score. And other all, we need to get at least 5. I'm not going into details of that because it is already explained these days by every our other like candidates. So I'm not going in detail. So let me shortly go through that. ISBA is again introduce an identity, and situation. S is for situation, and B stands for background, A stands for assessment, and R for recourse. And in identity, introduce an identity that please mute your mic. Patient name, age, address. Situation, that situation, medical history, family medical history, and lifestyle. B stands for background, that is hospital treatment record. A stands for observation and assessment, and R stands for recourse. And we have 7, we need to fulfill this content in order to get a better score. That those are 7 components. Let's see what are they. First, start with date. For example, if the date is 30 August 2019, and the next one is address, emergency department, consultant, hospital, whatever the address they had given in the writing task. And then the salutation. The next one is reference with the patient full name along with Mr. or Mrs. and then the date of birth or age, whatever according to they are given in the case notes. Then introduction, most important information, secondary information, social or family history, and conclusion. Our 6th point is yours sincerely or faithfully, and the last but not least, our designation, whether it is charge nurse or head nurse or registered nurse, whatever it is. Now, let me go through the case notes. So when you get a letter, what you have to do? First, to directly go to the writing task. Here, the writing task is mentioned as plan. Using the information given above, write a letter to the neurologist who will be attending a patient in the emergency department. So we have to write a letter to the neurologist. So then start from the beginning. Our patient is Maria Joseph, a 39-year-old woman who has been a patient at your hospital. You are working as a head nurse. Apart from the usual childhood illness such as chickenpox, she had been healthy. See, in this case notes, there are many dates. All the dates are given in the chronological order. So it's a small case notes and you don't find much difficulties to deal with this case notes. Let's see, the first date is on 10th of May 2011. Here, they are given as subjective data, objective data, assessment, and plan. As we know that we all are nurses, and in the hospital we use these medical terms. Subjective data means what patient says, and objective data means what we observe from the patient, and assessment and plan. So let's see what are the subjective data is here. Frontal headache for 6 hours, mild associated suffering from nausea, no vomiting, patient with blurred vision but not aura, no other symptoms noticed. She has no family history of migraine. Objective, pulse is 96, BP 130/70, normal cervical spine movement and examination normal, and assessment probably due to excess tension or personal dilemma. Plan is to advise to take rest, given an analgesia, that is paracetamol. That was paracetamol. And on 14th, after 4 days, patient represented with the subject, again, the complaint of continuous headache. You can see that deterioration of symptoms, left-sided and frontal, blood, along with the blurred vision, thrombic headache, vomited 5 times during the last 3 hours, complaining of slight paresthesia. The observations were patient was distressed with a pulse of 103 and BP 150/90, normal peripheral nervous system, and assessment severe migraine possibility. The plan was to give stat. They had given pethidine 100 mg and intramuscular moxilone 10 mg. On today, that is 15th, the day of writing letter, there was a home visit. We don't know who visited her. That information is vague, but we can see that there was a home visit, and the nurse noted that patient had a fall, fell down at home due to severe left side headache, started some 5 hours after reaching home. Injured her right arm, bruisedness on the left leg, slurred speech, and half unconscious. Observations were pulse 100, BP 150/90, and extension 4 out of 5, and left leg knee flexion 4 out of 5. Assessment, probable intracranial pathology or space occupying lesion. Plan is for urgent assessment in emergency department. So here comes our importance of writing letter. Patient needs to have urgent assessment in emergency department. Now, I would like to move on. As we said already, there is no specific template for writing. We can write in our own way, but there are strategies which has to be met while writing. Like for example, those points which we discussed, like a purpose, concise, clarity, and those things should be done properly. Here, let me start with the date, 15 May 2011. And in the date, there is no comma, no need to put any comma, full stop, or anything, and date can be written like there are other ways also, like you can put slash in between, but you keep in your mind, if you are practicing like a specific way, continue doing that so that you will not mistake while doing the exam. So here I mentioned 15 May 2011 without date or slash or anything. Then comes to the address. Here we have the neurologist. The article is very important here. The neurologist emergency department, or even we can write here neurology department. Okay, since in the case note it is the emergency department, better to keep emergency department. Here also no need to write any full stop or anything, commas in between. Okay. Then the salutation is dear doctor. Dear doctor. Here also we can write dear neurologist. In whatever way we can, but it should be like for example, the doctor. It should be like a doctor should be there. Dear doctor or dear neurologist. Then comma. Then the reference is Miss Maria Joseph. The patient full name should be there in the reference, comma, age 39. If the date of birth was given there, we could write date of birth. Since the age had given there, we choose age to write, aged 39. So I hope this makes sense on you. We have completed with the first part, date, address, salutation, and reference. Let's go to our introductory paragraph, which is the soul of our OET writing task. If this paragraph is clear and if it is filled with excellent words, we can score a better mark in OET writing. So here I will read this introduction, what I wrote. Then later on we will discuss. I am writing to refer Miss Maria Joseph, who requires urgent neurological assessment and management at your facility. She has the suggestive symptoms of intracranial pathology or space occupying lesion. See here, I'm writing to refer. Here, instead of refer, you can write, I'm writing in regards to, or you can write, thank you for seeing Miss Maria Joseph, because we are writing to the neurologist. You can write in that way also. There are many other ways. So, but you can choose your own way. You can make your own style. Okay. So here I choose, I am writing to refer Miss Maria Joseph. Well, it's a singular noun. So I wrote requires. S should be there. For an urgent neurological assessment, the better to have an urgent word is there because we are writing for an urgent intervention and management to our at your facility and from your facility. You have to always keep in your mind that, like, if the patient is going to their facility, we need to make at your facility, or like a home visit cases, we can write from your facility. Do not make mistake on this word, at your facility or from your facility. If you are not clear with this at or from, if you have a confusion, please don't write that. You can even leave it. You will not be penalized for that. And the next sentence is, she has the suggestive symptoms of intracranial pathology or space occupying lesion. Here, the purpose, they are given in our writing task like a query. They are suspecting to have some intracranial pathology for this patient. So I have kept this as a suggestive symptoms of, to rule out, to have a definitive diagnosis. We need urgent neurological intervention. You may be thinking that why the diagnosis didn't write on the first, why the purpose is on the second. As per our 2.0 OET guideline, the purpose has got more prominent. So better to write purpose in the first and then the second sentence, the diagnosis. So you will not be penalized for both, but better, it will help you to make a better score. Then the next para, initially, Miss Joseph presented to the hospital on 10 May 2011 with 6 hours history of frontal headache, remarkable, which may be due to excess tension or personal dilemma. Therefore, she can write from Miss Joseph, or if you start from initially, also no harm. Like, since we have many dates, better to start with initially, because so when we say initially, he will directly, his mind will go to that case note and what happened to the patient, Miss Joseph. Why I have written Miss Joseph? So I wrote presented to the hospital on the date before the article is on 10 May 2011 with headache. If you do the case note, you can see that 6 hours is like a frontal headache for 6 hours. So better to always to paraphrase to the in another format. So I put it in another way: 6 hours history of frontal headache,
Excuse me.
along with nausea and blurred vision. Connective sentence will give weightage to our writing. So along with nausea and blurred vision. On assessment, when we assess the patient, what we found out on assessment were unremarkable. Day of 10th, when we if that all the findings were unremarkable. Personal dilemma, like maybe it all happened due to her tension. Therefore, she was advised for rest and analgesics. Like a rest and analgesics was advised for her. Here in the case note, you can see paracetamol for 500 mg for hourly and all. No need to mention all those things because it was happened in the past, and no need to write all the doses. Better to avoid that, because when we write analgesics, no rush that. The present condition, present medication, we need to write it full. Now, let's start with the next paragraph. Initially, Miss Joseph presented to the hospital on 10 May 2011 with a 6 hours history of frontal headache along with nausea and blurred vision. On assessment, findings were unremarkable, which may be due to excessive tension or dilemma. Therefore, she was advised for rest and analgesics. Here you see, I started with initially. Like as I said in the beginning, the dates are in a chronological order there. So it is not confusing us. So even we can start this letter without initially, but if you put initially, doctor, it is easy to understand what happened in the initial stages, then followed by the next steps. So he can easily understand the patient condition. That is why I started with initially, then the Miss Joseph. Here from the second paragraph, we can write the second name of the patient along with Miss or Mr. Miss Joseph presented to the hospital. Presented means she presented by herself, not like was admitted on the other letter. Yeah, presented to the hospital. On is the article before the date on May 2011 with a 6 hours history of frontal headache along with nausea and blurred vision. 6 hours history. In the case note, you can see that it is in the other way. Frontal headache for 6 hours. Here I have paraphrase. It is always better to paraphrase if you get a chance from in that letter, because they will think that we are able to manage the case note. So 6 hours history of frontal headache along with nausea and blurred vision. I have used the connectives there along with nausea and blurred vision, and also and is there also. See, so in order to make together, I wrote and there. And on assessment, so assessment, when we assess her, what findings we got it. After comma after the assessment, findings were unremarkable. You go through those in that date, you can see that there were like so many things, not aura, no other symptoms. This, if there is no, you can say that like findings were unremarkable. Instead of we should not write like all these no symptoms there. Okay, whatever it is negative, we should not write, because it will be to a neurologist and whomever it is. Don't write that symptoms which is not there, even though they have given there. It is like irrelevant data. Okay. So findings were unremarkable, and which may be due to excessive tension or personal dilemma. Like they said that it is maybe due to excessive tension or personal dilemma, means like a situation where she is unable to take a decision from when there is like a multiple options are there in front of her. Therefore, she was advised for rest and analgesics. Like, yeah, I have used the passive voice here. She was advised. Somebody was advised to her was advised for rest and analgesics. Here in the case note, you can see paracetamol 500 mg for thoroughly. These things no need to mention here. If you write, no harm, but better to make clear and concise because it has happened in the past. Like paracetamol was given in the past, and now what is the more important on that present day? So just simply write rest and analgesics was advised for her. I hope it is clear for you. Is it? Can I move?
Yes, ma'am. Yes, ma'am. Yes, ma'am.
Okay. Now, the third paragraph. Yesterday, Miss Joseph represented with a throbbing and continuous headache, especially on the left side and frontal, along with a slight paresthesia. In addition, she was distressed and had multiple episodes of vomiting over the last 3 hours. On examination, her blood pressure was slightly elevated to 150/90 mm of Hg and pulse 103 per minute, which was probably due to severe migraine. However, she does not have any family history of same. She was commenced on Pethidine 100 mg and intramuscular injection of Maxilon 10 mg. Here, see, let me explain to you this paragraph. Yesterday, I wrote yesterday. Why did I wrote yesterday? We can write after 4 days. It happened after 4 days. Both way we can write it. There is no harm. But you think that if we write after 4 days, then the note has to think that when it will be the after 4 days. If we write simply yesterday, it will be like pointed to that it was happened, the incident was happened just the previous day. So it will be more clear and concise. Miss Joseph, again, Miss Joseph, as I said before, and represented. In the first paragraph, we wrote presented. Here, the patient is represented. Again, she came with what? Deterioration of symptoms like a throbbing and continuous headache. Again, her symptoms was like a throbbing and or another quality of that headache, throbbing and continuous headache, especially on the left side. Why these things are important? And frontal along with the slight paresthesia. Why these things are relevant to this case note? Because we are writing to a neurologist, so he need to know what is like what is specific area of the headache. So if we are writing to a nurse or if we are writing to a community center, these things are we can make it as irrelevant data. Since we are writing to a neurologist, this data has got relevancy, so we need to add on to that. In addition, she was distressed. She was distressed and had multiple episodes of vomiting over the last 3 hours. Here, see, instead of that 5 times, I have put it as a multiple episodes. So we paraphrased in another way. On examination, in the previous para, I put like one assessment. Here I wrote on examination. So it's like a different word. Her blood pressure was slightly elevated to 150/90 mm of Hg and pulse of 103 per minute, which was probably due to severe migraine. So these things here, the readings are important because neurologist is going to diagnose her. Maybe because of like a high BP, right? Simply elevated. How much elevated? Neurologist has to know that it is how much the patient. So better to write the reading because we are writing to the doctor. So he need to know these things are very relevant to the patient. It is probably due to severe migraine. They were not able to take a decision and they said that it is suspected due to severe migraine. Then in the first paragraph, in the case note, it is given that patient doesn't have any family history of migraine. In the first paragraph, you imagine that in the case note, they make us confused that in the first paragraph, they put that patient doesn't have migraine. They didn't mention anything about a migraine. First paragraph, I mean the first date. There they didn't mention anything about a migraine. They said that it is due to like a tension or dilemma. But here they are talking about the migraine here. So better to add it here. Even though they are suspecting the patient have a severe migraine, she does not have any family history of same. We need to tell them that she doesn't have any family history. So there are less chance of migraine. And she was commenced on Pethidine 100 mg and intramuscular injection Maxilon 10 mg. Here, she was commenced on, or has been commenced on. We always have a mistake, or we have confusion on these areas. What is was commenced on, or what is has been commenced on? Was commenced means it is finished in the past. They had already given. The action is already completed. Has been commenced means it is going through. It is started and it has to be continued for the coming days too. So Pethidine no need to continue to coming days. It is already given. So that is why was commenced on 100 mg, comma. When you write medication, put after the name of the medication, put comma 100 mg. Then if you have only 2 medication, write and. If you have more medication, write with semicolon. Since we have 2 medication only here, I added and with an intramuscular injection of Maxilon 10 mg. Here, when I read one of the case note from our main platform, I saw that somebody has put this intramuscular injection after that, after this one. So we don't know whether how they had given Pethidine for this patient. Maybe IV, they gave intravenous for the patient. So better to write after Pethidine, don't know the road, Pethidine, comma 100 mg, then finish, then this intramuscular injection for Maxilon 10 mg. I hope it is clear for you.
Yes, clear.
Thank you. Now we'll go to next slide. Our last slide. On a home visit today, comma, it was found that Miss Joseph had a due to pre-existing symptoms. Injured right arm along with bruisedness on the left leg. On assessment, she was semi-conscious and had slurred speech. The pulse and blood pressure remained the same, as well as the extension and flexion power were. Here you see, this is we are writing letter to the doctor. You can write today during the home visit or on a home visit. Both it is right. Okay. It was found that Miss Joseph had a fall due to pre-existing symptoms. Why did I choose this word to write here? Pre-existing symptoms. But if we write again the headache, this going on repeatedly. So better to synonyms the word with the pre-existing symptoms. That means what we said earlier, that same symptoms. Due to that symptom, she had a fall at home. Then apart from that, I used a connection of apart from that, comma, she was injured her right arm along with bruisedness on the left leg. Okay. So then on assessment, it was noted that she was semi-conscious and had slurred speech. Her pulse and blood pressure remains the same, as well as extension and flexion power were 4 out of 5. So for example, here the blood pressure reading is the same, almost same. So we can write it remains the same. Okay, remains the same, as well as extension and flexion power were 4 out of 5. I hope you are clear with this paragraph too. Now I'll move to the last slide. It would be appreciated if you could Miss Joseph in the emergency department for further management. In the last, you can write, it would be appreciated if you could assess. Like here, we can write these phrases like it would be appreciated if you could. That is enough. That is a good sentence. And Miss Joseph in the emergency department. Miss Joseph, you need to write patient all the paragraph. That is better to get a good score. Miss Joseph in the emergency department for further management. If you have any like these phrases, we need to put in all the letter. If you have any further queries, please do not hesitate to contact me. Yours faithfully, Why did we use yours faithfully here? Yes.
No recipient name. We wrote dear doctor.
Give the name of the recipient, we put yours faithfully. Many of us make mistake while writing the sincerely and faithfully, but please keep in your mind that if the name is not given there, use faithfully. If, like, for example, like when you write in to a friend, like those who are with a close relation, you use with early. Doctor is little more respectable position, no? So the name is not given, then, and even some doctor's name, some case notes we can see with the doctor's name also. But if the name is in general, if the name is not given, use with the phrase of faithfully. If name is there, use sincerely. And then your position, don't forget to write your position here, head nurse, charge nurse, or whatever it is. If nothing is given, you can simply write registered nurse. And after yours faithfully, comma, head nurse, nothing. You can just stop it. So I have done with this, and I hope it is clear for you. Now, please tune into our platforms. You will
Thank
get
you so much.
with more explanation, better notes, and more clarification. Watch Father's video today. I have watched all his videos before coming to. Although I watched before all his videos, today coming to this, before coming to this session, I have watched again all the videos because I must be crystal clear before coming to this session. So I watched again. So you please go and watch again all his videos. It is like wonderful videos are there. So you please watch it. Will not. Okay. Thank you. Bye-bye.
Bye, ma'am.
Bye. Good night.
Thank you. Bye, ma'am. Thank you, ma'am.
Thank you, Rejeena.